Hey, so good afternoon, everybody. My name is Christopher South, and I am the Education Coordinator here at Metro Area Ambulance in Bismarck, North Dakota. And so today we're going to be going over the state-approved IV course. And so this course is designed for the EMT to be able to maintain IV medications, all right? What this course does not authorize you to do is certainly not to place an IV. It does not authorize you to insert an IV. All right, so I'm going to read a couple of things to you. The purpose is to allow a basic emergency medical technician to monitor a peripheral IV fluid during interfacility transport with the following restrictions. That means this IV had to be established at a hospital that's going from one level of care to the next. This is not for a paramedic who started an IV line and then gives it off to you. It's not the way that works. No medications or nutrients have been added to the IV. It's just fluid. All right. The EMT may monitor and maintain the flow of intravenous fluid. The EMT may shut off the flow when complications arise, except when a person is licensed to practice medicine or a RN advises the EMT by voice contact to keep the IV running. At no time will the EMT be allowed to start or restart an IV. The EMT must initially take a 3-hour approved course, which is what you're doing now. You're taking the didactic portion today, and you'll come by and see me and I do the rest of the course with you. Every year an EMT is required to take 1 hour of refresher training, okay, 1 hour of IV refresher training. By the end of this lesson, you will be able to state the 4 circumstances under which an EMT may not monitor IV administration, the things that you can't do. We're going to talk about the different types of IV fluids that you can monitor. We're going to talk about the potential consequences of failure to comply with current state BLS IV monitoring policy. And we're going to talk about what the EMT should be doing to request a transport a patient with blood or other non-stock IV solution. Talk about a couple of different things here. We're going to identify IV therapy equipment, which includes various solutions, administration sets, and extension sets. We're going to take a look at a couple of those. We're going to list 2 different reasons for monitoring IVs. We're going to list 3 problems which might be encountered while monitoring an IV. We're going to list different complications. We're going to talk about all kinds of different IV stuff. So this is what an EMT can do. An EMT may monitor the administration of stock crystalloid IV fluids, which include 5% dextrose, which is also known as D5W. You can carry normal saline, lactated ringers. You can carry 5% dextro and 0.45 normal saline, which is known as D5.5. You can carry D5 and lac ringers together, which is known as D5LR. All right, EMTs may monitor the IV fluids using an IV pump, provided they meet the following. If your organization trains you in a particular pump by a qualified instructor, they have to have their name on a preceptor form in the Office of Emergency Medical. Basically, the state office has to have your name on a list with what type of pump and who authorizes you to use them. Must only use the fluids listed that we just talked about. You cannot use anything else, only those fluids that you're allowed to use. So EMTs may not, under any circumstances, perform venipuncture. So what that means is if we have an IV established and it comes out, you can't just go, well, you know, I'll just put the IV back in, I'll start a new one. Can't do that. All right? One of the other things is maybe you, in your previous life or previous life experiences, you took a class on doing venipuncture, maybe you worked in a lab or whatever, but as an EMT, you are not allowed to do a venipuncture in the field. All right. EMTs may not, under any circumstances, monitor the administration of blood products, or any fluid-containing added medication, electrolytes, or nutrients. If it's got anything added or it's a blood product, that's going to be an advanced provider, okay? All right, so maybe you might be asked by a hospital, maybe you have asked by a physician or a paramedic or whatever, they ask you to carry something that you're not allowed to carry. You simply advise them that it's against state policy for you to do that. You need to contact an ALS agency, whatever you need to do. Make sure that qualified personnel are the ones who are carrying the IV fluids. All right, if you go above those measures and take on, start an IV or give blood or whatever, your duties beyond this module will be practicing in violation of the Medical Practices Act and could subject to legal proceedings. So in short, just don't do it. So the purpose of IV fluids is simply to add volume to the circulatory system. So what we're doing is adding volume to the patient, all right? That's all that the IV fluid is doing. It establishes and maintains a life support or access line for fluids or drugs in a patient of questionable medical status. So if they are transferring this patient from one place to another, they have established that basically that they want to make sure that this patient is receiving IV fluids or has an IV line for different types of medications and things later on. All right, so we're going to take a look at some of the different equipment that we have. We're going to take a look at some of the administration sets. All right, and we're going to talk about a few other things that can happen. All right. So the first thing, let's take a look. You'll get a lot more hands-on once you come in and actually do the practical portion of this exam. All right, if you're taking this module, is there's some different components of IV fluids, IV solutions, and the setup. So basically, you're going to have a couple of different components. You're going to have the actual container that holds the fluid, which will be the IV bag. All right, so the IV bag actually contains the fluid, whatever crystalloid that it is that you're taking on. All right. So the IV bag is going to be connected to a drip set. All right, we have different types of drip sets. All right, we have what's known as a macro, which is a 20 drop or 10 drop set. All right, you have a micro, which is a 60 drop set. But also, if you're having an IV pump, you may have a different looking IV setup. All right, so let's take a look. The bag and everything should already be spiked if you're maintaining it. So let's take a look at all the components of how this works. All right, so you have the container, which actually contains the fluid. The connection, or the set, actually connects up to the fluid, and fluid drains from the bag into the drip set, all right, down the tubing. And the tubing also is going to have a stopcock or a roller cock, all right, which is going to help us to adjust the flow rate of that medication. As you can see, when I opened it up, that it began to flow, all right. So that roller actually controls the rate in which that fluid is dripping into the patient. On the IV tubing, you're going to see that there's several different connections in there. These are called ports, and these ports are places of access for us to be able to give medications through the IV line to the patient. The end of the IV connection tubing connects up to the patient at the actual IV line. All right, so the IV line is typically going to consist of when the cannula, which is a little piece of plastic, is inserted into the vein, the part that sticks out, the IV line is connected up to it. But most people do what's known as a saline lock now. And it's a very short little loop of IV tubing. On one end actually connects up to the IV cannula, and the other part is a port on the end of it. And that's just a little bit of an extension, all right? Sometimes called as a J-loop. As it sticks out, all right, that's where we connect up. So while you're maintaining IV fluids to a patient, all right, a couple of things can happen to cause the IV solution to stop running. One of the main things is if you have the patient We've got them in the ambulance. We've got them hooked up to all of our different monitoring devices. We're going down the road, and maybe you've got the blood pressure cuff on the same side of the patient's IV. If you've got them connected to the IV and the patient also has a blood pressure cuff on that side, every time that blood pressure cuff inflates, the IV line is going to stop working. Okay? It's going to stop working because it has actually created pressure, and that pressure is going to keep that fluid from flowing up. And so it'll stop until the blood pressure cuff releases. When the blood pressure cuff releases, it'll start back working. So what if you're going down the road and you're seeing blood that's backing up into the tubing? You want to make sure that, number one, that everything is open, okay? And also that the bag is high enough that there's plenty of gravity to push the fluid back up into the circulatory system, okay? A couple of things that can happen with that, all right? So what happens if you notice that the patient, that there's lots of swelling at the IV site, maybe there's quite a bit of irritation at the IV site, the patient isn't able to tolerate it, what do you think you should do? You should call either one or two places. You should call the facility that started the IV, or call the facility where you're taking the patient with the IV, tell them what's going on, give them a report. They are going to give you instructions on what to do. They're either going to tell you to stop the IV, or they may tell you to take the IV out, okay? If they tell you to take the IV out, it's very simple to do. You just take a 4x4, you're going to take all the tape off around the IV site, hold your 4x4 over the IV, and slide the IV out and hold pressure until the bleeding stops. All right? Follow the directions of that facility when you call if you have any issues about the IV. So let's talk a little bit about some more about the equipment. So the container or bag is measured in millimeters or cubic centimeters. All right, so milliliters is going to be ml, cubic centimeters is going to be cc's. Both of these terms are interchangeable. All right, so 1 milliliter equals 1 cc. They're the exact same. Containers are generally either 500 or 1,000 milliliters. So this is a 1,000 milliliter. This is a 500. As you can see, it's basically half the size. All right, so let's take a look at some general uses. D5W, or any of the formulas that contain dextrose, may be used for a diabetic patient who is suffering from hypoglycemia. Normal saline is typically used for diabetic patients with problems other than hypoglycemia. Patients who may need blood and patients with cardiac symptoms can all have normal saline, but typically normal saline can be used generally for any patient. Lactated ringers, or LR, is for patients who need large amounts of fluids replaced because of hemorrhage, burns, or other condition causing fluid loss. It can also be used on patients with cardiac symptoms. They may also be in combinations of fluids such as D5LR, D5 half normal saline, etc. All right, just like I talked about our administration steps, a macro is going to be 12, 10, or 15 drops. They're all used for rapid infusion of fluids. Micro drips, or 60 drops, are primarily used for children and maintenance IVs to keep open, and are also used for the administration of many medications. All right. You as an EMT, for whatever squad, whether you're here at Metro Ambulance or whether you're on another squad somewhere else and you're watching this video today, you need to know your equipment that you work with specifically. You need to sit down, go through all of the equipment, and be very, very competent in using that equipment. Some other equipment you want to have available are arm boards, especially for pediatric patients. If their IV is started in the antecubital space, which is in the bend of the arm, if they're moving it around, the IV is going to stop, so an arm board may be beneficial. So let's take a look at the assessment of the system. So we're looking at our system and making sure it's good. The first thing we look at is the solution. We should look for clarity. How does that solution look? Is it clear? Is there any chunks floating around in it? Does it have a different color? Check for any tags or labels indicating additives, because if it has additives, you can't take it. Check for leaks around the administration port. So look and make sure this should all be sealed and there shouldn't be any fluid leaking out of it. So on the administrative line, check for security or attachment to the bag bottle solution. It should be nice and snug. Make sure there are no kinks. All right, when we are transporting it, let's be very, very careful because these things can coil up and get loops in them. And one of the big things is they, because they are quite long, is they can loop. And if it's got a loop, be careful. Make sure the loop is nice and secured up here by the patient. I always like to make sure that if I've got extra loop and stuff, that I secure it under the straps so it doesn't hang out, because it can get kinks, coiled, and it can catch on stuff, and you certainly don't want to pull an IV line out. All right? So I asked the patient if there's any pain or burning at the site or anything. Prior to transport, it is your responsibility as the attending EMT to receive a report about the patient from the physician or the nurse in charge of the transfer. Wherever you're picking the patient up, we want to get a nice report and find out why the patient has the IV fluid, why they have to have it en route, all the good stuff. You will do an assessment of the patient, informing the physician or nurse of the limitations of your care. It is of critical importance that you know as much about the patient as possible, since any problems that may occur from then on is going to be your responsibility. So the more you know, the better off you're going to be. Be aware and plan for problems that could occur if the patient is unstable during transfer. Who are you going to call if things go wrong? Proper information pertaining to the patient must be passed along to the EMT prior to accepting the patient for transportation. If during the transfer report you find something wrong that you are not licensed to handle, tactfully draw it to their attention, ask them to correct the problem, such as removing the medication from the IV, or provide you with assistance on the transfer. So once the infusion has been established by the medical facility, the fluid should drip steadily into that chamber. Adjustment of the infusion plate or row, you're typically not going to have to worry about doing that. The proper adjustment of fluid rate must be monitored and maintained. Too much IV fluid can be dangerous to the patient. We're going to talk about that in just a second. The IV must be handled with care as it is easily dislodged or otherwise disturbed. Carefully monitor the flow rate, make sure it's flowing. Check the tubing for kinks, disconnection, or leaks at regular intervals, and particularly after moving the patient. If the IV stops dripping, do the following. Check the height of the fluid container and raise it if possible, because it may just need to be raised up to get gravity to work a little better. Reposition the patient's limb. If they've got their arm pulled up, pull it down nice and flat. It'll help it to run. Check the tubing for possible leaks, all right? Do all of those things to see if that's the reason why the IV set will not run. If blood is backing up in the tubing, check the system for proper flow rates. Flush the tube by increasing the flow rate for 1 or 2 seconds is basically taking that stop and opening it up and allowing a little bit extra fluid to run in. It should clear that IV line out and then put it back to the original flow rate. All right? Good deal. All right, so let's talk about some potential complications of IV therapy. And the first thing is infection. Infection is usually caused by poor aseptic technique, and this is going to be on the actual IV insertion itself. Normally, we're only seeing when the IV has been established for an extended time. To prevent infection, prevent contamination by keeping all the equipment sterile, dry, and aseptic, making sure we're using clean gloves, examining all equipment solutions and tubing for problems before using, removing any jewelry from the limb with the IV and document when and where and who it was given to, maintaining sterility of packaged items when opening them. All right. You can have what's known as a pyrogenic reaction, and this is caused by foreign proteins or pyrogens that are entering the body. To prevent this, do not use Do not use containers of fluid which look cloudy or have any leaks. So signs and symptoms of a pyrogenic reaction. They're an abrupt onset, usually with about 30 minutes after we start the infusion. They're going to have severe chills, backache, headache, nausea, vomiting, and malaise. Shock with the potential of vascular collapse. So the treatment for that is to stop the infusion immediately, treat for shock, and you're going to need to call for ALS backup. So an embolus is one of the main causes where plastic IV cannula detaches. Is where the IV cannula is actually torn, or we can have air entering the system. And as little as 10 cc's of air may be fatal in some patients. So certainly we don't want to be giving air to a patient. So signs are going to be rapidly developing shock, cyanosis. There is unconsciousness is possible. So the treatment is clamping the IV tube close to the insertion site, placing the patient on their left side with legs elevated and head down. Administer high flow oxygen, contact med control for orders, and proceed to the nearest emergency department. So circulatory overload, especially in patients with pulmonary edema, that's where we're giving them way too much fluid and that fluid's actually backing up in their lungs. So the cause is too rapid or too generous administration of fluids. So signs are going to be venous distension. That's where we see that nice JVD. A rise in their blood pressure. They're going to have dyspnea, increased respiratory rate, and cyanosis can also be a late sign. All right. Infiltration is where the IV fluid goes in the tissue and not the vascular system. You may hear paramedics or RNs talk about a blown IV. This is what infiltration is. You'll see edema at the site, pain. You may be a little bit air, maybe warm to the touch. You can see leakage around the IV site. The flow rate could appear sluggish. The treatment is to stop that IV immediately. All right, stop that IV immediately. Here's the thing, folks. If you're having any issues with IV stuff, the first thing you should do is just go ahead and clamp it off. Stop it. It's better to clamp it off if you think there's an issue with it, and immediately call for some assistance, whether it's ALS assistance, or it could be as simple as calling either the sending or the receiving facility to find out what they want to do with the IV fluid. All right? So that is the basics of the didactic for part 1 for IV maintenance to be able to maintain IVs. All right, the next part that you'll need to do, you'll need to come by here and you have to do the hands-on portion with me and also take the exam. So again, this is the didactic portion of the IV maintenance.